Hi, my name is Dr. Joe Childs. I'm a board-certified chiropractic neurologist. And on this DVD today, I'm going to talk to you about whiplash injuries and auto accident injuries. I'm also going to talk about the innovative methods that we use in our office to treat patients that have either acute whiplash injuries or auto accident injuries, meaning they just had one and they're in severe pain, things like that. And we're also going to talk about the chronic auto accident injury patient, the person that had the auto accident injury 6 months ago, or the patient that had it 4 or 5 years ago and they're still having pain and symptoms. We're going to talk to you about how we treat both of those patients. Before we go into talking about that, what I'd like to do is tell you a little bit about myself. Again, I'm a board-certified chiropractic neurologist. Now, what does that mean? What is a chiropractic neurologist? Well, just like in medicine, you can specialize in medical neurology or medical orthopedist. In chiropractic, you can also specialize. A lot of people are not aware of that. And so I chose to specialize in chiropractic neurology. The difference is we treat acute and chronic neurological problems and conditions differently than medical doctors. Medical doctors are going to use drugs and surgery, where what we're going to do is we're going to do specific types of neurological stimulations, spinal decompression, chiropractic care, brain-based care, nutritional approaches, oxygen therapy, and we do it without drugs and surgery. So we're going to talk about how we help patients with auto accident injuries. Again, I'm a doctor of chiropractic, so before you go on to be a chiropractic neurologist, you go to chiropractic school, which is about 8 years of education, and then the chiropractic neurology education is another 3 years beyond that to specialize. I've been fellowship trained in functional neurology, which is drugless neurology. I'm fellowship trained in childhood neurodevelopmental disorders, and a lot of times people will have car accidents and their kids will be injured, so we want to certainly let you know that we are trained in pediatrics. I'm trained in functional nutrition and blood chemistry. I'm trained in spinal decompression therapy. Spinal decompression therapy is for people with disc problems and joint problems, and also spinal biomechanics. And prior to me doing all of this, I was an exercise physiologist. I went to Penn State University. So that's a little bit about me. Let's talk about the post-auto accident symptoms. Number one, you can have acute and subacute cervical acceleration, deceleration injuries. You can get neck pain, headaches. I mean, if you just had a car accident yesterday, you may be suffering from headaches, or your neck may be really stiff. You may have some pain that's between the shoulder blades, back pain. Back pain is very common, whether it's an acute injury from a recent car accident or one that you had several years back. In fact, a lot of people's neck pain and migraines may be due to an auto accident that they had 6 months ago or 5 years ago, and they may not really even relate it back to that auto accident. Paresthesias, which is numbness and tingling in the hands. Extremity pain, pain in the joints, or pain in your arms, or pain in your legs, or weakness because the nerves that come off of your neck that go down when you get a whiplash injury, you can really shear some of those nerves, and that may make you have some weakness or atrophy in your arms. Cognitive difficulties, and that's because the brain is affected in whiplash injuries and with auto accident injuries in general. That can create a traumatic brain injury, and that's where my chiropractic neurology comes into play, because we treat not only musculoskeletal conditions, which is the bones and things like that. We also treat the central nervous system, which is the brain and the spinal cord. Again, dizziness and lightheadedness, because sometimes you can really affect your inner ear. In fact, a lot of patients that have car accidents, they may think they're fine. They may get, the neck pain may not be right after the accident, and they think they're okay. They sign off. They feel fine. But then about 6 months later, they start developing vertigo or dizziness. They may have lightheadedness, facial pain. That's because sometimes when you hit the airbag, but also the neck muscles are connected right into the jaw muscle. So people get TMJ, which is temporomandibular joint dysfunction. We may have, patients with this may get auditory symptoms, which means that they may have hearing issues. They may get ringing in the ears. Their balance may get really bad. In fact, a lot of people with like auto accident injuries that are a year old will start to say that their balance is not good, and they don't always relate it back to the auto accident. Ocular dysfunction, vision issues, double vision, things like that. These are all the signs and symptoms that you can get from an auto accident. So today what we're going to talk about is we're going to talk about the epidemiology of whiplash injuries. We're going to talk about the biomechanics of the whiplash injury. What exactly happens? We're going to talk about challenges for patients, challenges for physicians and attorneys in diagnosing these things. We're going to talk about soft tissue injury. We're also going to talk about how we diagnose these whiplash injuries, and we're talking about some of the innovative treatment methods that we use in our office. This is an epidemic. In fact, the number of whiplash injuries, the cervical acceleration, deacceleration injuries, is growing. We're seeing a lot more. In the U.S., there are 3 million new whiplash injuries every single year. And in low-speed rear impact crashes, which is called LOSRIC, the risk of injury is about 30 to 60%. Of the people that are injured, about 35 to 50% never fully recover, meaning that they are left with problems the rest of their life. 14% are going to become disabled from whiplash injuries. And whiplash is the leading cause of sickness and sick leave and disability in our working population. So it's very important to understand that. It's a modern epidemic. Why do we have the increase? Well, we've got stiffer seat backs. And not only that, there's very little concern for these low-speed rear impact collisions. And we're going to talk about why there's little concern for that. The science is there that there should be even more concern, but there's very little concern. And that's why we see some of these people with these chronic problems, because they never get truly fixed right after the car accident. A couple definitions. CAD is cervical acceleration, deacceleration injuries. LOSRIC, which is low-speed rear impact crashes or rear impact collisions. We're going to talk about these today. Okay. Here's the myth. The myth is this, that most people think that the property damage, how much damage you have in your car, is related to the risk and the severity of injury. And what you're going to find out, that is a complete myth. And what insurance companies would like to have is they like to say that crashes without property damage are safe. And guess what? The science is saying absolutely not. That is not true. You can have no property damage or very little, just a fender bender, and you can have a lot of damage. So injury risk and injury severity are directly proportional to crash damage. That's not true anymore. The science is saying that just because your car wasn't that badly damaged doesn't mean you're not going to have a problem. In fact, these people tend to be left with more problems down the road because they're less concerned for. So the fact is this relationship does not exist and is without scientific basis. So at low speeds, crashes are highly elastic, resulting in a proportionate greater energy transfer. So if you're sitting here watching this right now and you say, well, my neck's only a little stiff and there was only 10, 15 miles an hour, so it should just go away. Be very careful, because down the road you may be developing migraine headaches and you may not ever relate it back to that car accident injury that you had 6 months ago. Okay? The biomechanics of low-speed rear impact collisions. Well, first a few definitions. Well, we have impact velocity. That's how fast you're going when you get hit. Then you've got the change in velocity. That's the change in the velocity after you're hit. And we call that delta V. 10 miles an hour, delta V is considered a low-speed rear impact collision. Above 12 to 15, you can develop spinal cord injuries and traumatic brain injury. We'll talk about that as we go. Rear impact. Why rear impacts at lower speeds are significant is the factor which injures the occupant is the kinematic energy of the crash converted into the occupant motion, which is called kinematic. So you've got the movement of the body in the car and the actual movement of the car itself. Delta V is often considered to be the holy grail of these issues here, but it's acceleration, okay? Acceleration has a time-dependent aspect, so it's the acceleration of the body in the car. Acceleration equals the change in velocity over the change in time, okay? So let's explain this. When the duration of a crash is long, which is high-speed crashes have long duration, the acceleration will be low because their time element is larger. So you can have a lower acceleration, actually, in high-speed crashes. Interesting, huh? When the duration of a crash is brief, which is low speed, the low-speed rear impact collisions, the acceleration is going to be high because the time is going to be brief, okay? So you have more acceleration, more tissue damage. So here's an example. At high speed, the car was going 36.9 millimeters. Delta V, which is 17.1 miles per hour. The head acceleration is 10.3. So it was high speed, long duration. The crash at 36.9 miles per hour, 17.1 mile per hour delta V. Major property damaged, but the head acceleration was 10.3. Now, if you can compare this with a low speed, brief duration, zero damage crash, the closing speed was only 7.8 miles an hour. Didn't seem like it was that fast, right? Delta V was 5.8, or the change in velocity was 5.8 miles per hour, and the head acceleration was 12.7, and that's because the time of the accident was so low. And that tells you that property damage, this is for the scientific minded, I will have you know, that property damage is not going to let you know if you have personal damage to your body. Okay? So let's talk a little bit about the biomechanics of these low speed rear impact collisions. Well, when you look at a spine, a normal spine should have a nice straight configuration from the front, should have a curve from the low back, curve in the mid back, and a curve in the neck. Okay? So what happens is, the first thing that happens is there's bumper contact and the seat strikes the occupant. So the seat hits them back, and then what's going to happen is you're going to get a flattening of the spinal curves, which is going to create a stretching, compression, and ramping. And then you get a head lag phase where you're going to get a high shear axial compression extension phase. And then what happens is you get a re-entry, forward head acceleration, peak shear reverses, forward bending moments, and now that normal curve can be lost within a matter of seconds after an acceleration, deceleration, cervical injury. And so that's exactly what happens. So your spine, the normal shape in your spine, gets violently damaged when you have an auto accident. So it kind of looks like this. Boom, flattening of the curve in the neck, extension phase, and then it goes back the other way. Now the cervical curve is essential for you to have, and I'm going to go over some x-rays at the end of this video where we can really zoom in and look at these x-rays. But when a normal spine has 3 curves, you should have this nice curve in your neck, mid back, and low back. So that's a normal spine. This is somebody that has a loss of curve. That loss of curve can come from a lot of things, but one of the biggest, most common reasons for somebody to lose the curve in their neck is whiplash injuries, even if it's just a low speed whiplash injury. This is Alfred Brake said, loss of the cervical curve stretches the spinal cord 5 to 7 centimeters and causes a state of disease. This was research done by a neurosurgeon that says that when you lose that curve in your neck, you stretch your spinal cord. And that can really cause a lot of symptoms. Numbness, tingling in the hands, things like that. The other thing that can happen is when you get into an auto accident, it may set you up for a faster forward head posture. Now you see people as they age, they tend to get like this, you know. People that have a lot of car accidents, they're going to have more forward head posture, meaning their head's going to go forward. So the amount of auto accidents you have or the damage in your neck is going to cause you to have that forward, that aging of your spine is going to happen more rapidly. Again, I want to go over this in more detail with the x-rays that I'm going to go over at the end of this video. Couple of things about the biomechanics of the low-speed rear impact collisions is the size of the crash partners, the impact vector. The impact vector means where you hit from the side, where you hit from the back, front, was it from an angle, what were the contact points of the car. Property damage does let us know how much impact there was, but it doesn't really tell you as much about acceleration. Head restraint geometry. Do you have a good seat back or do you not have a very good head restraint? The type of seat that you have. There's a lot of variables that go into crashes. The spine from the front should be perfectly straight. And so if you're hit from the side, you may get a translational force into the spine which can cause you to shift to one side. And that is seen here where this person has this translated spine to the right. This is what we did to them. We corrected their spine with our biomechanical care. It can also happen in the lower back. You may be hit from the side and bam, you go flying into the door, right? And what that's going to do is cause you to now have this bend in your spine. That can set you up for lower back problems. This is a pre and post x-ray of a patient we've helped. Some more biomechanics of these low-speed collisions. Sex, age, the older you are, the more arthritis and degenerative changes you can have in your spine, which means just even a little impact can cause you all kinds of problems. Your medical history, do you have vertigo, have you had a past stroke, things like that. The position that you're in as you're in the vehicle, was your head turned? Boom, if your head's turned and now you have that impact, that's going to really change the kinematics of the injury. And your awareness. Do you see it coming or do you not see it coming? Okay? So when you see it coming, you really brace yourself, which tenses those muscles up and can sometimes make the injury even worse. Okay? So what happens when you get into these injuries? Well, you can have all types of damage in a lot of different places. You can have a fracture of the end plate, which is in this vertebral bone. You may have a transverse disc tear, which means that the disc, which is between the bones, can actually shear and tear. That can create a lot of inflammation, a lot of pain. You may have a radial disc tear, which is a different fiber in the disc. You may have a rim lesion, which means you get some damage or some fracture to this front of these bones. You may have a disc contusion. You may have the anterior longitudinal ligament may tear from there being too forceful of an extension motion, which will tear that ligament in the front. You may have a posterior longitudinal ligament tear from that phase of the whiplash injury. You may have a disc herniation. You may have a interspinous ligament, which are the ligaments between here. So there's a lot of things. You may have a contusion, like a big bruise to your spinal cord. These are all things that can happen in these types of injuries. You may actually stretch some of the nerves that go out into the arm, and that may cause your arm to be numb and weak and tingly. You may have a soft tissue injury, okay? Soft tissue injury is the disc, that's soft, the muscles. Most of the pain and symptoms you have are not really coming from the bones, it's coming from the things that connect the bones, the muscles, the ligaments, the discs, things like that. This is the disc right in through here. The more damage you get into your spine, the car accidents and the bends and things like that, and the car accident may create such an impact that it herniates a disc. And so we can do an MRI to see if there's a disc bulge. But when you get car accidents, it predisposes you to degenerative changes in your spine. So when you look at the spine, you should have nice, big, healthy disc spaces. Okay, so a normal spine should have big, healthy disc spaces in here. But as you get into more car accidents, or even just one car accident, it's going to predispose you to having faster, more rapid degenerative changes in your spine. So it's important that if you do have a car accident, whether you have pain or not, you get your spine checked. You see, did you have biomechanical change in your spine? Do you have the normal shape from the front, from the side, or has that injury caused you to heal in the wrong position, which will predispose you to degenerative spinal changes? Other symptom patterns, depending upon which nerve root is irritated, it may go down certain areas of the arm. It may just be the inside of the fingers. It may be the outside or the fingers that are closer to your thumb. These are called dermatomes, distributions. We can determine that when we do our neurological exam. We do a very extensive neurological exam to find out and document where your injuries occurred. See, again, these are the symptoms we went over, but don't forget neck pain, headaches, shoulder blade pain, cognitive issues. We can have dizziness, facial pain, all these things. Here's the thing. This is a study that we are just now beginning to probe the depth of the cervical acceleration trauma to long-term consequences. They did 2,184 residents of Saskatchewan were surveyed, and 15.9% had a history of a cervical acceleration injury. The post-cervical acceleration deceleration group had nearly twice the rates of the following compared to those that never had a car accident. Neck pain, headaches, allergies. Allergies, people that have car accidents are more prone to having allergies going forward. Breathing disorders, because the nerves not only control muscles, they control your lungs and things like that. Low back pain, cardiac problems. Interesting, your heart. You have a higher chance of having heart problems if you've had an auto accident. And digestive disorders. Okay, twice as likely to have these issues going forward. So car accidents, acute injuries, if not dealt with, can cause you to have chronic health problems. Okay, and they don't have to be back pain and neck pain. The other thing is concussion or mild traumatic brain injury. Now again, I'm a chiropractic neurologist, so this is dear to my heart, but when you get into an auto accident, what happens is your brain can bang against the skull, and that can create a shear and acceleration, deceleration injury to the brain, which can cause you to have an actual brain injury in that now the brain does not function. This is why a lot of people with auto accidents will be more prone to things like confusion and cognitive issues after the accident. They may get dizziness and vertigo and balance disorders because the brain is affected. Okay, that's important for you to understand. So it's not just a musculoskeletal, you know, my neck hurts. It can affect your brain. How do we diagnose these injuries, these cervical acceleration, deceleration injuries? Well, we take x-rays. I showed you some of those. In fact, at the end of this video, I'm going to go over all the different x-rays that we take. We can do an MRI. The MRI lets us see the disc. Do you have a herniated disc? Do you have a bulging disc? We need to document this. We can do a CAT scan that look for really diffuse fractures or tough to see fractures. We can do SPECT scans. Okay. We can do electrodiagnosis, so we can do EMGs, electromyograms. We can do NCV testing, and we'll send you out for these if we think it's necessary to find out if you have any neuropathies because of this. We can do electronystagmography, which basically is we're going to look for vestibular disorders, people that get dizziness. When you shear your head really fast, you can affect your inner ear and cause you to have future dizziness and balance disorders. Okay, we could also do something called somatosensory evoked potentials. These are things that we can send you out for to do. Now, what makes us different than every other doctor that you've seen? Well, we specialize in treating chronic and acute neurological and musculoskeletal injuries. Okay, we treat you neurologically, biomechanically, and metabolically. Neurologically means we're going to look and see, has your nerves been affected by this accident? Biomechanically, do you have proper spinal structure, or has the whiplash injury caused you to have poor structure? And metabolically, we're going to look at you even nutritionally to find out if there's ways that we can help you heal faster. One of the things that will happen when a patient first comes in, let's say with an acute injury, we want to get the inflammation down. So we have lots of things that we can do to reduce inflammation. One thing that I really find is excellent is laser therapy. We can do laser therapy or light therapy, and it can reduce or eliminate acute and chronic pain, reduces inflammation and swelling. It's going to improve nerve function. We can also do electrical stim, things like that. It's going to strengthen and repair bone and soft tissue. So laser therapy is great, especially with those acute injuries that come in. The car accident just happened last week. The other thing that we do is we do chiropractic manipulative therapy, which is CMT, which means we're going to look at your spine. We're going to find out, do you have a normal structure in your spine? And we're also going to look at your range of motion. We want to document, do you, after the car accident, have full bending this way, full bending this way? Can you tip your head down? Or does it hurt to bend this way? Does it hurt to twist this way? Chiropractic adjustments gently stretch and move the bones back into the normal position, and they also get some loosening in some of these muscles and ligaments, and it also helps heal some of the structures. So it's going to reduce fixation. Sometimes these joints don't move so well, they're fixated, so we'll get in there and we'll do some light adjustments. Now, we're not going to do that to somebody that has this acute injury. We're going to slowly work into that, especially when you're dealing with some of these soft tissue injuries that occur from these accidents. We also do something called non-surgical spinal decompression therapy. Patients that have auto accident injuries a lot of times will herniate their discs, or they'll bulge their discs, or if they're in the older population, they may already have some disc damage pre-existing, and now they get into that auto accident and bam, then they got this really bad disc herniation. So we will use what's called non-surgical spinal decompression therapy. What it does is it opens up the disc spaces and takes the pressure off the disc and creates a negative pressure, draws in fluid, draws and sucks that bulging disc back off the nerve. It's very comfortable. A lot of patients fall asleep on the table. And the other thing we'll do is we'll put patients on oxygen therapy at the same time, which is really good for their brain and nervous system. We'll use this machine called the Active Therapeutic Movement Machine. This is for patients that, since they've had the car accident, if they bend this way it hurts like heck, or if they bend this way it hurts, or they arch back and it hurts. And so what we do is we put you in this machine that braces you. Okay, because what will happen is after you have an auto accident injury, even after you have the injury and the injuries are somewhat healed, and these injuries, when they heal without chiropractic services or without laser therapy or without decompression therapy, they heal more sensitive. They heal 1,000 times more sensitive because the scar tissue is more sensitive. And that's one of the things that when you have an auto accident injury, if you get right in and have care, what will happen is we can lay down normal tissue instead of scar tissue. But what will happen is sometimes people with these chronic injuries from these auto accidents, they may have a pain that every time they bend to the left, they fear the severe pain. Well, what this does is it braces you so that it allows you to bend to the left without any pain. And so if you bend to the left without any pain, because you're braced, we can reboot your central nervous system into making it normal or making it pain-free to go into that motion. It's essential. And I've had patients that for years after that auto accident, every time they bend forward, they have pain, put them in this 1 or 2 sessions, and now they can bend down, touch their toes without pain. It's a great machine. I wouldn't practice without it. We do cervical corrections. Once we get your spine feeling better, we want to work at getting that curve that you lost from the auto accident back to a normal position. Here was a lady that came in. She had a whiplash injury, severe neck pain, disc damage in her neck, and as we got her through care, we restored this arc back into her neck. Again, at the end of this video, you can watch some cervical corrections. We're going to do co-management with other providers. We will work with your medical doctor. We will work with your orthopedic doctor. We will work with whoever we need to work with. We may put you in a cervical collar if necessary. We may have you use a cervical pillow. We may give you home traction to do. We may do nutritional support to help you heal. We like to give you what's called a whiplash guide, so you understand. We want to educate you as best you can if you had an auto accident. So we're going to leave no stone unturned in getting you back to where you were before. We'll do neurological treatments. If during our neurological exam that we do, we find that you have certain areas of your brain because of that traumatic brain injury that are not functioning well, and they may have gone way under the radar from your emergency room visit, and so we can document these things. A couple neurological tests. We're going to look at right and left blood pressure, tissue oxygen saturation, heart rate and rhythm. We're going to look at reflexes, eye tests. We're going to look at cranial nerve testing, cerebellum testing, which is the back part of your brain in through here. We do a very extensive neurological exam. We're going to do brain-based therapies. Let's say after the car accident your coordinated abilities are not as good, or you have balance issues, or you're dizzy. We may do something called the interactive metronome, which is something where you listen to reference tunes and we work on your coordination. We may use specific types of eye light therapy, eye exercises. Let's say you've got neuropathy in your feet. We can do something called the rebuilder to improve the neuropathy in your feet. We can do a lot of different things from a brain neurological perspective. We may do oxygen therapy. Oxygen is fuel for your brain. A lot of times people that have had auto accidents have damage to their brain, and so we can put them on oxygen, which is fuel, and activation, which are the exercises that we do, and you combine that at the same time, it causes the brain to remold itself. It's called neuroplasticity. We do that also. Here's the deal. If you come into our office, if you had an auto accident, or you've had one 5 years ago and you're like thinking, you know what, this makes a lot of sense, maybe my issue is due to this auto accident, or you just had one last week and you're hurt and you don't know what to do, come into the office. We're going to document your injuries. We're going to find out the extent of the damage. We're going to work with your attorney, or we will refer you to one if necessary. If you don't have one and you want to be supported by an attorney, basically we can send you, we know attorneys in the area, we can send you to one that can help you. If you already have an attorney, we can document your injuries and work with your attorney for your case. We will bill all the auto insurance in the office. In the state of Pennsylvania, the auto accident injury is paid for. Okay, so your initial visit would be paid for, all your care, as long as you haven't exceeded the allowed amount. But if we're the first doctor you're seeing for this, there's going to be coverage for you, and we will do all that billing for you. We want to make it as least stressful as possible for you. The other thing we will say is we're going to leave no stone unturned in getting you back to your pre-accident status. We're going to do everything we can, whether it's going to be spinal decompression therapy for the herniated disc, brain-based therapy, whatever we're going to need to do to get you functioning back to your normal, back to where you were, so you can have a healthy quality of life. That's what we're going to do. So this is all for this video today. I'm all through talking about auto accident injuries. If you'd like to come into the office, you just had, heaven forbid, you had an auto accident, or you had one in the past, and you want to have us take a look at you, you can call us at 610-518-3370, and we'll do a full initial exam and work up to find out exactly what type of injuries you sustained in your accident. Just give our office a call. If you already came into our office and you're watching this because you came in with an auto accident injury, we will go over your findings when you come back. We'll do a full report of findings and let you know exactly what's going on, and we'll let you know if we can accept your case. So that's it for today on this video. Now when this video turns off, there will be another video called Cervical Corrections. You can watch it, and it will go over all the different x-rays that we take in the office for auto accident injuries. We'll also go over some of these corrections that we've made. So thank you. I appreciate it. Take care.